Magandang hapon po mga katribu and welcome to Kalingang KaTribu. Walang tigil po ang aming pagka-update sa COVID-19. Yung monkeypox ba ay delikado para sa ating lahat? At ano ang bagong variants ng Omicron? Ito po ang ating special guest, si Dr. Ted Herbosa. Siya po ay Special Advisor ng National Task Force versus COVID-19, Professor and Chairman of Emergency Medicine ng PGH, UP PGH. Hi, Dr. Ted.
Hi, good afternoon, Ma'am Cory, at lahat ng mga nagsusubaybay sa iyong programa sa Daily Tribune.
Bakit walang tigil ang mga variants ng COVID-19?
Yan ang characteristic ng SARS-CoV virus 2. Ito isang RNA vaccine and they continue to mutate. Habang nagkakaroon ng transmission, talagang nag-mutate siya or nag-evolve siya into later cases. So itong latest variant natin, yung Omicron, ito yung tumama sa atin, Ma'am Cory, nung December, January, at bahay-bahay yung mga nagkahawahan, no? Although hindi na puno yung ating mga hospitals. So right now, ang inanunsyo ng Department of Health ay yung bagong sub-variant, no? Yung BA.4. Yung tumama nung January, Ma'am Cory, is the BA.2. Tapos nung April, meron tayong nanggaling Finland, yung BA.2.12, pero hindi naman ito kumalat. Yung BA.4, ito yung pinakabagong anunsyo ng Department of Health. Inanunsyo nito last week at concerned kami kasi ito yung nanggaling sa isang Pilipino na hindi vaccinated. Nanggaling siya ng Middle East, dumating nung May 4. At nung tinest siya nung May 8, ay naging positive. So naka-quarantine naman siya dahil hindi siya vaccinated. Nag-undergo siya nung 14-day quarantine at nung nag-positive siya, nadagdagan pa yung kanyang quarantine. So ang hinahanap natin ngayon kung ito ay nakapaghawa pa ba ng ibang Pilipino. Mukhang hindi naman, sapagkat wala tayong pagtaas.
So isang kaso lamang yon.
Isang imported case ng Pilipino na galing Middle East.
Okay, so Doc, yung pagkagawa o evolution, no? Evolution to ng virus, no? Totoo ba na ang layunin ng virus ay hindi mamatay, na palagi siyang buhay na buhay, kaya in order to adapt, kailangan magkaroon ng mga iba't ibang variants. Totoo ba yun?
Totoo yun. Yung virus cannot live alone, Parang almost inanimate siya. Kailangan niya ng living thing, yung human host. So para tuloy-tuloy ang pag-perpetuate niya at may mga anak siya, kailangan laging may host na nai-infect. Kaya nagmutate, nagkaka-mutation siya. Pero ang maganda sa mutation, although nagiging mas nakakahawa, nagiging less deadly. So kagaya nung last year, meron tayong Delta. Doon sa Delta, maraming namatay. Maraming hindi ma-confine sa hospital kasi kailangan ng oxygen at ventilator. Hindi na nangyari yan nitong January sa Omicron. Karamihan, nagstay lang sa bahay at gumaling after 4 or 5 days. So parang ubusipon na lang or trangkaso siya. So it's becoming milder, pero ang BA.4 parang 10 to 15% more contagious than yung Omicron na 2. So kaya medyo alarm tayo na makapasok dito sa atin yan.
So Doc, itong virus na BA.4, ito ba ay kasing mild ng BA.2.2? Kasi
Yes.
I remember nagkahawaan
ito ay as mild.
Doc, sa isang party last December, isang dinner party nasa garden pa kami Hindi ko alam pala, mga 10 tao yata o 12 ang nagkahawaan nung gabing yon. Hindi namin alam pala na lahat kami, bumagsak kami the next day within 24 hours yun.
24 hours.
Pero very mild symptoms of flu lang yun.
That's correct. No? Omicron pa rin to. And you are correct. Pag nagkahawahan tayo with the BA.4, ganun pa rin, mabilis lang. Ang takot namin as doctors is that may tatama ang lolo, lola, or someone with a comorbid condition, may ibang sakit like diabetes or cancer, at siya ang pwedeng ma-ICU. So dahil very contagious siya or very transmissible, medyo alarmed din ang Department of Health. So nag-iingat tayo at yan yung kumalat sa Europe at North America, yung BA.4 at yung BA.5.
Okay. So are you saying na yung mga seniors at elderly ay mas vulnerable
Oo.
sa epekto ng Omicron kahit siya ay mild? So,
Correct.
itong mga elderly at senior, kung wala silang comorbidities tulad ng diabetes o heart disease, ano kayang magiging reaksyon nila sa Omicron?
So, depende talaga, Ma'am Cory, kung ano yung kanilang immune status, no? Some people are 80 years old, 90 years old, but they're healthy and their immune system is functioning like a 30-year-old, parang 30-year-old. So, makikita natin yan, no? Meron tayong mga senior citizens na malalakas pa, tumatakbo pa ng marathon. So, these people probably have immune systems that are strong. Pero meron din tayong mga 60, 70 years old na yung immune system nila mahina. They cannot mount a defense. Hindi nila madepensahan yung katawan nila. And these are the ones na nagiging complicated, severe, napupunta sila sa ICU at pwede pa sila magkaroon ng long COVID, no? Yung tinatawag na long COVID or long haul COVID na tinatawag.
Yung long haul na yon, nakakapagtaka kasi meron akong kaibigan na nagkasakit siya December during the height of the Omicron. So sabi ko sa kanya, pero meron siyang comorbidity.
Oo.
She's diabetic and she has hypertension. Pero controlled naman. She got okay na siya after 1 week. Pero bumalik.
Yes.
Ang simptoma niya, pagkatapos uminom ng antibiotic, pinainom ng antibiotic ng doktor niya, at after 1 month, Doc, nag-test pa siya ng positive.
Correct, oo. So there are cases like that, no? Dalawa ang pwedeng mangyari dyan, Ma'am Cory. After a bout of COVID-19, ang immune system mo is depressed. So pwede kang magkaroon ng secondary bacterial infection. So ibang microbe naman papasok sa katawan mo, and because kakalaban lang ng body mo against a virus, hindi siya makamount ng same defense against the next or the second virus. And then yun yung magkakaroon ng post-viral infection, pneumonia or bacterial infection. Yung isa naman, yung pag-positive even na weeks later na magaling ka na, nakikita talaga namin yan because the PCR test is very accurate, no? Dahil accurate siya, nakukuha niya kahit yung mga fragments lang. Or ibig sabihin nun, patay na yung virus, hindi na siya nakakahawa, pero nagfo-false positive pa rin siya. So akala nung test, meron pa siyang virus, pero in fact, fragments na lang of the remnants nung namatay na virus sa katawan niya. So hindi pa na-eliminate. So yan ang reason kung bakit nagte-test tayo, even after some time, nagkakaroon ng test na positive.
Pero akong mga kaibigan, kasi siguro 12 of us, no, were down, mild symptoms. Ang tanong ko sa kanila, nagpa-test ba kayo? Sabi nila, hindi na kailangan alam namin Omicron yun. Kasi all of us were down at the same time. Totoo ba yun? Is that the right way of thinking?
Pwede rin yun. You can also just isolate. No? The important thing is, hindi ka na maging focus of additional transmission. So if you have symptoms, you were exposed to somebody who was positive. Actually, ginagawa nila to sa Amerika. Pag yung father nag-positive, yung mother nag-positive, tapos yung anak nagkaroon ng lagnat, symptoms, hindi na nila tinetest yung bata kasi tutusukin pa yung ilong nun eh.
Yeah, right.
I-assume na namin Omicron din yon. Tapos the same treatment na, isolate na rin, give the same medications and vitamins para ma-protect. So pwede naman yon, no? Yung testing is more for confirmatory. Pero pwedeng presumptive, parang yung ating presumptive president-elect. Presumptive diagnosis pwede versus confirmatory. So siyempre pag kinonfirm na ng yung presidente, proclaimed na siya. Ganun din sa testing. Meron tayong confirmatory test at yan yung PCR test. Hindi lagi kailangan. Pwede namang mag-isolate ka na with symptoms lang.
Yan ang unang ginawa ko, Doc. Nag-isolate ako tapos tumawag sa aking doktor. Sabi ng doktor, wag ka nang pumunta sa clinic ko. Sabi niya, maniniguro na lang ako. I'll make you take antibiotics.
Correct.
a powerful antibiotic, and increase your vitamin D, vitamin C, zinc, melatonin, get some sunshine, isolate yourself pero get some sunshine if you can. Ayun lang ang sinabi niya, get enough
Yes.
bed rest and hydrate. Uminom ng
Yeah.
sapat na tubig.
Correct. Because itong mga sakit naman ito, if you are healthy, are self-limiting. Ano ibig sabihin ng self-limiting? You recover. Parang common colds or influenza, flu, trangkaso, after a few days you recover. So tama yung ginawa ng doctor mo. Just observe. Baka nga pag nagpunta ka sa clinic niya, mas mahawa ka pa dun sa ibang patients na. Kasi sa hospital.
Huwag ka nang pumasok dito.
Correct. Oh. So isolate, protect the public health. In fact, Ma'am Cory, if you notice, if you've been to Japan, makikita mo yung matatanda na sumasakay ng tren na naka-face mask. Yun kasi yung public health measure nila kasi they don't drive cars, so they have to ride the public transport. Pero talagang pinagmamask nila to protect the others. Hindi sarili niya ang pinoprotect niya. Baka meron siyang bug, pinoprotect niya para hindi na siya makahawa doon sa train. And etiquette yun sa Japan. Hindi kayo magsasalita pag nasa loob ng tren.
Ganun lang ako. Kasi Doc, ang daming nagte-text sa akin ngayon. Ang daming mga katanungan, kaya tingin ako sa cellphone. Sabi ko sa kanila, mag-text kayo dyan sa Daily Tribune. Alam po niyo, here in Kalingang KaTribu, we are committed to giving the proper and right information. Siyempre, nang sa ganun, magbibigay po tayo ng mga safeguards sa ating minamahal na mga katribu. Okay, Doc, is it important kung, let's say, nahawa ka ng Omicron o ng COVID-19, is it important to have a test to know if you have antibodies?
Kung ito tinatawag ng neutralizing antibodies.
Yes.
Actually, hindi namin recommended. No? Number one, medyo expensive yung test. It's called the ELISA, enzyme-linked immunoassay test for the antibody. But the antibody na matitest natin dyan ay isang antibody lang. Yung spike protein or S protein antibody. Madaming antibodies na nadidevelop ang body mo after an infection. Meron dun sa core, I think there are about 4, 4 yan. And then, hindi lang yon, if you've had an infection, not only does your body have an antibody, magkakaroon ka rin ng memory cells. The memory cells, remember na ito kalaban tong microbe na to. So the next time another microbe similar enters your body, these memory cells or T cells will tell the body, produce na kayo ng mga white blood cells and phagocytes para labanan yung infection sa nose and mouth. So, you will mount 2 types of infection, yung antibody or yung antibody-mediated at yung cell-mediated response. So, dalawa yan. Once you've had an infection, naaalala na, may memory, your body will recover. Kaya tayo, hindi na tayo nagkaka-measles uli, hindi na tayo nagkaka-chickenpox uli if we had it in childhood. So, na-remember na ng body natin to fight whenever that virus enters our body. So, ipapuproduce niya na yung memory cells ang tawag doon. Cell-mediated immunity yung technical term. So, lifelong na yung immunity mo. Hindi lang sa pag-wane. So, you can have your antibody levels low. Pag nagpa-test ka, baka mag-worry ka pa. Hindi naman. May antibody, may immunity ka pa rin kasi may immunity that your body remembers. So, useless na. Sayang lang yung pera mo para magpa-test kung may antibodies ka or not.
Mahal yun, Doc, yung test na yun.
Oo, kasi it's a private laboratory. Usually, you pay anywhere from 5,000 to 8,000.
Pero ang mahal pala nun. Sayang.
Just for knowledge lang. Wala ka namang malalam, di ba?
So, Doc, sabi nila, mas mabuti pa na mahawa ka ng Omicron, sa Omicron, kasi para siyang meron ka ng natural immunity. Yes or no?
Yes. Well, let me qualify the yes. Yes, natural immunity is better. But no doctor in his right mind will recommend a person to risk your life by getting the infection naturally because there is a vaccine. Yung vaccine is your passive immunity. So natural immunity is active, no? But we don't know kung magkaka-complication ka. We don't know if you will be the one that will have long COVID. So parang risky, parang dangerous yun, di ba? It's not. When in fact, there is a safer route. The safer route is get the vaccine. So the vaccine is passive immunity. walang mangyayari sa'yo, you suffer a mild illness siguro, maglagnat ka lang, and then you develop antibodies. So to me, yung vaccination, very important talaga. I would still recommend immunization. Sabi nga nila, there are two things in medicine that is most historically important. One is the development of potable drinking water. So nawala yung mga diarrheal diseases, di namatay mga. The second is the invention of vaccines. Nung na-invento ang vaccine and immunization, millions of lives of kids were saved and millions of lives of senior citizens who get vaccines are saved. Kesa yung sapalaran. It's like a Russian roulette, di ba? Hindi natin alam kung sino yung patient na magkaka-natural immunity with complications. So, kung may paraan not to get that, okay, I'll just give the vaccine. Pero totoo yun, Ma'am Cory, what you said earlier, natural immunity is so much better and stronger than passive immunity.
Okay.
May risk lang.
So, kahit na-recover ka na sa COVID-19, kailangan maging vigilant pa rin, ano, Doc?
Yes, because of the mutations. Yan ang ano. So, you've heard of friends siguro who've gotten COVID 2 times, 3 times, 4 times. May kilala pa akong ganun. I think that's the reason why you still have to wear and recommend mask wearing and care, especially for other people. Kasi like itong bagong variant, sabi nila the new variant has what they call vaccine escape. So may vaccinated ka na, but there's still a chance that it can infect you. Kasi nga, because meron siyang mutation na hindi siya na-recognize ni antibody. May mutation sa spike protein.
Kailangan i-upgrade din ang vaccine.
Correct. Kailangan i-upgrade din yung vaccine. So parang the vaccine is designed to identify, si Miss Cory Quirino yan. Dahil iba, naka-shades or something, hindi niya makikilala, hindi niya mapapansin. So you get infected. So yun yung tinatawag na vaccine escape. Nagka-mutation or change doon sa spike protein. So it's able to escape the protection given by the vaccine. And that's why kumakalat siya sa Europe and America. 90% ang vaccination rates nila doon. Pero nagkakaroon pa rin sila ng surges. So that's why we are a bit scared about those cases here.
I see. Doc, can we go over ulit? Siyempre, it bears repeating. Can we go over the basic safety protocols para sa kaalaman ng ating mga katribu? Uulitin po natin.
Okay, let's repeat the minimum standard protocol, minimum public health protocols for respiratory illness. Number 1, make sure you're always wearing your mask when you go out. So yung pagsuot ng face mask, hindi pa natin inaalis. It's still a mandate, especially if you are going to crowded or enclosed spaces. When you ride the elevator, talagang dapat naka-mask tayo. Magandang quality mask. Pag nagpunta ka sa mga mall na maraming tao or the marketplace na maraming tao, anytime there are crowds of people, very important to be wearing your mask. And then if you have to eat in
Doc, question lang. Sorry to interrupt kasi we're on wearing a face mask. What about double face mask? Is that effective kung doble ang face mask?
The double face mask we recommend when there was a peak, kagaya nung Omicron surge natin in January. Nag-recommend kami ng double face mask kasi almost everyone is getting infected. Yeah. So the better protection is doubling the face mask para mas maganda. Right now, mababa yung cases natin, less than 1% lang. I don't think there's need to wear a double face mask, no?
Okay, good.
Pangalawa, making sure na naguhugas tayo ng kamay lagi. That's the use of the alcohol rub or the alcohol spray.
Okay,
normally we get infected because we ride the elevator. If you press natin yung button. Kung yung previous sumakay sa'yo, hinawakan yung ilong niya, nangulangot, tapos pinindot ka, syempre, napindot mo rin yun, tapos hawakan mo yung nose or eyes mo, you can also get infected.
Right.
So, not only
kahit nasa ATM machine, Doc, ATM machine.
ATM machines, tama, ATM machines, elevators, even utensils in a restaurant, di ba? Yung on the table. So very important. Riding the plane, yung mga pag-touch dun sa tray, they discovered in a biological study na pinakamaraming mikrobyo yung table, yung kinakainan mo sa
Ay, oo.
sa plate. So i-sprayan mo 'yon pag sakay mo sa plane. So Yun, yung riding a plane, you always wear a mask because it's an enclosed space.
Correct.
So, kung wala ka namang alcohol, the key is always wash your hands. So every
Soap,
time you
with
enter
soap talaga, sabon.
soap and water will kill the virus. This virus is lipid-based. And when it's lipid-based, ordinary soap will destroy the virus. Matutunaw siya dun sa lipid. Di ba parang oil? Mag-ano siya kasi oil-based siya. So good cleanser and wash your hands after you touch anything that's dubious, di ba? So wash your hands all the time. Kung wala kang wash hands,
Gaano kahaba ang washing the hands? Sabi nila kasing haba.
Happy birthday.
Oh yeah, happy birthday daw.
Sing happy birthday. Yung happy birthday, happy birthday, happy birthday. Pagka natapos mo yung kanta ng happy birthday song, you will go all through all the course. So there's a correct way to wash your hands. Most women, ngayon, most women laging may alcohol rub yan sa handbag nila. Ano yan, there. Or you carry those wet sanitizers, yung pang children. Those are also alcohol-based na pwede. So yan ang mga tips natin sa mga nakikinig. You carry the alcohol gel. Pag wala kang soap and water, instant yan. May makakapag-decontaminate ka. Yung sanitizers na wet sanitizers na madami namang available niyan. So you always have that in your bag. And then of course, ordinary soap and water. Number 3 is distancing. So when you're in a talking, let's say in a party, sabi mo you were in a party, sometimes it's very important na hindi kayo masyadong close. Kasi nga pag nagsalita, that's how, you're laughing, you're telling a joke, you're speaking aloud. So, and you're eating. So tinanggal niyo yung mask niyo. So ano ang protection mo? Have a distance. So like Ma'am Cory, you hold parties siguro, you host parties at home. So make sure that the seating is not too near to each other, di ba? Hindi naman siya romantic dinner eh. Get together lang. Make sure na tama-tama lang yung mga ano. And then, ang advice ko nga in party...
How many feet away?
Well, 1 meter away is still the recommended. 1 meter, 3 feet per chair. And then, pag-alternate mo para hindi sila nakaharap. If let's say it's a big table, diba? Yung hindi sa directly on the other person, para you're speaking medyo patagilid.
Ganon. Pero alam nyo, Doc, napansin ko sa mga restaurants kasi bukas na yung mga restaurant establishment. Yung mga taong kumakain, nag-share pa ng pinggan, nag-share ng dish. Dukot sila ng dukot.
As long as there's a serving spoon and they don't contaminate with their saliva.
Pag chopsticks, ganun lang. Paano yan?
So I hope it's a separate chopsticks for serving. Para mga high-end Chinese restaurant, meron silang dalawa. Diba? You have 2 Chinese, they have one chopstick pair is for taking the food and one is for putting in your mouth. So yun, magandang mga measure. But you only see that in the high-end Chinese restaurants, diba? Yung chopsticks. Right. So yeah, very important yan. And then when you're not eating, put your mask on again. Kahit makipagkwentuhan kayo. That's the best way to protect yourself.
Itutuloy natin itong safeguards para sa ating mga katribo sa ating pagbabalik. Huwag po kayong aalis.
Magandang araw mga katribo! Narito na ang mga makakasama nyo tuwing umaga sa programang Gising Na. Roy Pelevelo, Atty. Lia Badillo Crisostomo, Vernon Velasco, Kim Sancha at Chert Balagtas. Abangan ang programang Gising Na sa Facebook page ng Daily Tribune.
Ilabas na ang mainit na kape at samahan kami sa inyong pag-almusal, mga katribo.
Simulan natin ang bawat umaga with good vibes sa mga informative and recreational segments ng aming programa.
Maaari niyo rin ibahagi sa amin ang inyong opinion via Daily Tribune Facebook page at Tribune Now sa YouTube.
Makichika na rin sa latest showbiz happenings, mga katribo.
Kaya naman, magsama-sama po tayo sa
Gising Na!
Ang Daily Tribune may digital shows na din. Dahil sa mas lumalaki at mas lumalakas nating tribu, handog sa inyo ng Daily Tribune ang mga programang magbibigay buhay araw-araw. Be informed at mag-good vibes tuwing umaga sa programang Gising Na. Be updated sa news and happenings sa Tribune News on Cue. Mas kilalanin pa natin ang mga paborito nyong atleta sa programang The Athletes Tribune. Alamin ang latest entertainment sa programang What's Up. Ma-inspire sa...
Welcome back mga katribo. Ang guest po natin si Dr. Ted Herbosa, At pinag-uusapan po natin ng mga iba't ibang variants ng COVID-19 or SARS-CoV virus. Ito po ang aming safety protocols. We will sum it up. Number 1, wear a face mask. Number 2, wash your hands regularly. Kailangan, ayan, hugasan ng kamay. Dapat manatiling malinis ang kamay po natin. Dapat meron din po tayong alcohol. Social distancing. At Doc, number 4?
Number 4 is vaccination. Mag-get vaccinated. At kung mag-hold tayo ng get together, mas maganda if everyone is fully vaccinated and fully boosted. So that gives us, nakita namin na mga less ang chance manghawahan kung lahat kayo ay actually vaccinated. At kung kayo naman ay magkahawahan in case magkaroon ng infection, mild lang ang inyong magiging symptoms. So this helps us healthily get together and socialize sapagkat lahat ng mga friends na invite nyo ay fully vaccinated. I've attended parties nga Chine-check yung vaccine card. Papakita mo muna sa door. I've attended parties like that, which is a good measure, no? Hindi naman siya discriminatory. It means I'm protecting you because I got my vaccine. I'm protecting you who is my friend or my relative.
Okay. Doc, number 5.
Number 5, pag nagka-symptoms, mag-isolate ka agad. So if you get exposed, nag-attend ka ng party, the day after, you start to have sore throat, headache, cough, colds, mag-isolate ka na and seek a telemedicine consult. Usually, hindi na kailangan pumunta sa doctor. Go to a telemedicine consultation portal and then or call your friendly doctor, family doctor, and ask advice na lang kung anong iinumin, kung pwede na ngayon mag-offer ng electronic prescription ng doctors. Messenger ko lang ang mga prescription ko sa patients ko and they can show it na to the pharmacy and bibigyan naman sila ng mga prescription drugs. So ina-accept na ang e-prescription and then nagde-decide na rin si doctor kung kailangan mo magpa-test or hindi. Kung testing ang kailangan, there are home tests na available. You can dial up hospitals that yung magsaswab sa inyo pupunta na sa bahay. So this is safer than going to a laboratory na ma-expose ka pa sa ibang tao kasi lahat ng nandoon sa lab suspected of COVID yun. Di ba? Kung negative ka pala, ubusipod ka lang, doon ka mahahawa. So it's even better na home swab na lang kung possible.
Okay, Doc, mapunta naman tayo sa monkeypox.
Yes. Last week, the World Health Organization gave an announcement, nag-press con sila, and telling us that in the world, merong outbreak of monkeypox in about 20 countries. I think about 20 countries na. When they announced it, nasa 12 countries lang. Pero as of yesterday, nakita ko nag-increase na to 20 countries. But don't worry, those countries are in Europe and North America and Australia. Dito sa Asia, wala pang country with the reported case of monkeypox. Yung monkeypox is an old illness. Related siya sa smallpox. But smallpox has been eradicated in the world. Wala na tayong nakikitang smallpox since 1980. I think 1977 was the last case. So in 1980, after 3 years, we declared the world free of smallpox. But we still have some vaccines that are produced for cases, no? So yung monkeypox in Central and West Africa, nanggagaling siya sa exposure sa animals, rodents and squirrels and even some species of monkey. Ngayon, ang hawahan for many years since 1958, dun lang sa Africa, sa Central and West Africa. The World Health Organization was alarmed last week because there were about 12 countries reporting 1 to 2 cases of monkeypox. So ito yung parang bulutong tubig for our viewers, yung mga katribo dyan, sila yung parang may pantal-pantal na may tubig after a bout of headache, illness, and fever. Maglalabas yung bulutong tubig. Yun yung characteristic niya. Ang isa pang nakita ng ating World Health Organization, ayan, may pictures tayong pinapakita ng cases of the monkeypox or similar illness. Ang isa pang na-discover nila is na-infect ka nito through close contact and droplet infection. So unlike COVID is airborne. Yung droplet, ibig sabihin nun, kailangan hawakan mo yung vesicle na may tubig or ma-expose ka sa saliva
Oo.
sa saliva or sa sneeze or cough ng isang taong may monkeypox. And what they found, Ma'am Cory, ito interesting. They found that many of the cases na nag-positive dito sa America and Europe were men having sex with men. So we know it spread by close contact, but unusually, it somehow spread with men having sex with men. So hindi siya sexually transmitted. Kahit naman common colds, if you have an interaction with someone, pwede talaga kayo maghahawahan. So we can't say it's really sexually transmitted, but close contacts, and it seems to have spread among this population na ganun yung behavior. But that doesn't mean protected ng women kasi may men having sex with men and then they also have sex with women. So nag-warning din ng World Health Organization about this. Basta yung exchange ng body fluids, pwede kang ma-infect for a person. Now, the interesting thing about this monkeypox is that mahaba, ma'am, yung incubation period niya. It's 21 days.
Oh.
So that's the scary part. Because you can have no symptoms. Exactly. You can have 3 weeks of no symptoms and then suddenly the symptoms will appear. So that means marami ka nang nahawa in the time that you're incubating the illness. So that's the scary part. And that's why nagbigay ng alarm ang World Health Organization. They said there is a monkeypox outbreak in several countries, but the Philippines still has no monkeypox. The nearest country that has monkeypox to us is Australia, which has 1 case. So they have 1 confirmed case and several suspected. But Australia is 8-9 hours flight away. So hindi pa rin tayo takot. Most of this is for information and awareness of people. Well, you have to check now. If you are traveling, you have to check, ma'am. Di ba sabi niyo, pupunta kayong Europe. You have to check the list of countries that are you're traveling to. Kung kasama siya dun sa list. And tingnan kung ilan yung cases doon. Most of the countries, isa-dalawa pa lang. I think it's only the UK that has 20 and Canada that has 10. So the US has 1. So the rest are 1, 1, 1, 1. Nakita ko.
Doc, para sa kalaman ng ating mga katribo, para sa mga gustong magpakonsulta sa inyo, do you accept the consultation?
Yes, they can seek me out here at the Philippine General Hospital. Dito pa rin ako sa emergency department. I have an office here. They can come and contact me here. At kung wala naman ako, some of my other doctors are here also to take care of them.
Ayun. Thank you so much, Dr. Ted Herbosa. Always ready to help us, mga katribo. God bless you, Doc. See you very soon.
Thank you very much, Ma'am Cory. Thank you very much, everyone.
Ayan, mga katribo, ang ating very informative portion and episode with Dr. Ted Herbosa. Until next week again. Next week naman po, healthy cooking. Kailangan healthy po tayo lahat. Ito po si Cory Quirino para sa Kalingang KaTribu.
Every time I'm on the road, I can expect high performance from Phoenix Fuels. Now with Pulse technology, delivers enhanced power and acceleration to make every trip come alive.
Makinig at makisali sa usapan every Friday night at 6 p.m. sa I Speak KaTribu Podcast. Samahan sina Daniel at Alvin na pag-usapan ang mga relevant topic na tiyak kakarelatean nyo mga katribu. At pagdating ng Sunday at 7 p.m., Speak Your Mind with our I Speak program na sasagot sa mga tanong regarding the latest and relevant issues sa paligid natin. I-like at i-follow nyo ang Daily Tribune Facebook page at Tribune Now on YouTube para